Cyber Innovations in the Private Sector highlights case studies and the latest industry trends from private vendors. Explore innovative solutions, success stories, and exclusive insights from industry leaders. Stay ahead with the cutting-edge developments driving the industry forward.
As part of the NIS 360 special report, CyberSecTV has engaged with leading experts across several critical sectors impacted by NIS2. Today, we turn our focus to healthcare, one of the most vital yet vulnerable domains. Joining us is Giannis Kostakis, CEO of Leo CybSec, to discuss the sector's most pressing cybersecurity challenges, from legacy systems to supply chain vulnerabilities, and how we can move toward greater resilience.
ENISA places the health sector in the risk zone, which makes totally sense because we are talking about many legacy systems, supply chain risks, and insecure medical devices. But we need to understand why this is happening. The healthcare industry has been through a massive digital acceleration over the past years. We have seen great enhancements and digital transformation, starting from medical devices, AI technology embedded, and moving to cloud infrastructure. From our perspective and based on our experience by engaging with many healthcare organizations in the past, the root cause is systemic underinvestment in cybersecurity. We're talking about such a critical sector, right? We need to conduct impact analysis. We need to understand the repercussion of cyber attacks to healthcare. The most urgent fix from our perspective is to push for better standards and engage with the experts, with the security communities. We need definitely referees in the field to enable healthcare organizations thrive securely. I believe EU is going towards the right direction with all those standards, but we need to become a little bit faster. How are SMEs managing supply risks, and where are the biggest gaps? Most SMEs rely on one-time vendor assessments or static checklists, which don't capture ongoing risk, unfortunately. The biggest gap is in continuous monitoring, especially for software vendors and cloud providers who process and store sensitive information. We totally recommend third-party risk scoring tools and embedding security reviews in procurement workflows. Request always for compliance with industry standards. For example, ISO 27001 can definitely be a great baseline of security controls in place and policies. Of course, compliance does not equal security sometimes, but at least is one step closer to reduce the risk of supply chain. What vulnerabilities are most common in legacy systems and medical devices? First of all, I'm a big fan of threat modeling. You have to think like a hacker. Our customers a lot of times ask me, what should be worried about? I always suggest wear the hacker's hat. Think like them. You know your systems from inside out. If you can hack it, maybe someone else can do the same for you. Ensure you have a secure architecture in place, and also you protect your backend systems that process and store sensitive data. Don't put too much trust in medical devices that can fall in the wrong hands. A lot of times we see outdated firmware and hard-coded credentials in medical devices. First step is to make sure that you pen test your devices, but not only the software, but also your physical devices. Send those devices to ethical hackers that they can assess the security levels there. Make sure you use latest coding practices and you embed cybersecurity in your coding language and procedure. How should healthcare organizations structure incident response and crisis testing programs? First of all, a strong program starts with defined roles, playbooks, and tested escalation plans. We advise running those tabletop exercises and red teaming exercise at least annually, but include both clinical and IT teams in the same room. It's really important to simulate ransomware attacks and downtime scenarios. Those scenarios might feel people a little bit uncomfortable, but we need to embed these exercises into your testing plans. And of course, educate employees. Super important to run security awareness programs and make sure that everybody understands that cybersecurity is everyone's responsibility. You need to educate as well your board, and of course advocate for a security budget, something really important that cybersecurity leaders need in order to build successful security programs and incident response plans. What role do emerging technologies play in healthcare cyber resilience? AI can be used as a distraction, for example, see social media, TikTok, etc., etc., for good or for bad. Right now, cyber criminals are using AI to create attacks faster and cheaper. We need to be prepared and use AI for good. We need to bring AI on the defensive side of things. Healthcare organizations are using AI also to analyze sensitive information. We must ensure that that information is processed and stored securely. On the other hand, we need to utilize AI for better protection, resilience, and faster security analysis. We have seen amazing results after the use of AI security tools, and there are great tools out there. Of course, adoption must be paired with strong governance. Unfortunately, tech alone isn't a silver bullet.